Hey, this is Andrea Kane, and I'm here with HSC 114, Medical Terminology. We are studying the Language of Medicine, 12th edition by Davy Allen Chapner, and we are now on week 9. And this week we are covering chapters 13, which is the blood system, which is this first video, and then there will be a second video on chapter 14, which is the lymphatic and immune systems. Our course objectives are the same as they have been all semester long, 8.1 through 8.7 for every chapter that we do. And for this particular video and chapter in the book, our unit objectives are from the syllabus 9.9.1 through 9.9.10. So if you want to take a look at those, you can. But moving right along, our chapter goals, again, are the same as they have always been for the book in terms of terms and compositions and whatnot. We're really looking at this chapter about the formation and function of blood. So we have already touched a little bit on blood when we talked about the cardiovascular system, the respiratory system, and the urinary system, and the nervous system. But now we're really going to look at blood itself. So we want to talk about the different blood types and what is different about those types in the groups. And then blood clotting, we will look at combining forms. We will talk about what can go wrong with blood, lab tests, clinical procedures, abbreviations, all of those things, as well as the medical terms themselves. So let's go on. Blood transports food, gases, and waste to and from the cells of the body. That's its purpose, is it's a transport system. It carries all of those things. It drops them off, it picks them up. It drops them off, it picks them up. Other things that it can transport include chemical messengers, blood proteins, white blood cells, and platelets. So those are in addition to those things. It can also carry those others. All right, so what is blood made up of? There are 3 types of cells, and we covered this a little bit ago, a few chapters back, but just as a quick review, there are erythrocytes, red blood cells, leukocytes, which are white blood cells, and platelets, which are clotting factors. Then, okay, so those are the types of cells that are in blood, or types of blood cells, I should say. So you have your red blood cells, your white blood cells, and your platelets. You also have plasma, and the plasma contains water, waste, nutrients, salts, hormones, lipids, vitamins, all those types of things. Your cells are 45% of your blood volume. That means the other 55% is the plasma. And again, going back to this, your red blood cells are transporting nutrients and oxygen. Your white blood cells are going to be your fighters. They are the ones that are out there trying to keep your immune system well and fight off diseases, kill bad cells, those types of things. And then your thrombocytes are also called platelets, and they clot blood. They cause those clots to happen. So if someone's injured, you want those clotting factors to come and stop it from bleeding, because you don't want someone to lose too much blood. But where the clotting factors can be not so good is if, for whatever reason, the balance gets out of whack and the blood itself gets too thick because there's not enough thrombocytes or platelets. There's too much clotting, and it causes a blood clot to form, and then that causes a lot of issues. We studied that in the nervous system and the cardiovascular system, and even in the respiratory system when we talked about pulmonary emboli. All right, so we're going to talk about leukocytes, or white blood cells, first. They are made up of basophils, eosinophils, neutrophils, monocytes, and lymphocytes. And they each have their own task, so to speak, of what they do. Your basophils have heparin in them that prevents clotting, and histamine that's involved in allergic reactions. Eosinophils have phagocytic cells that are involved in allergic responses and parasitic infections. Then your neutrophils also have phagocytic cells, and they accumulate at sites of infection. Monocytes are also phagocytic cells, those become macrophages, and they digest bacteria and tissue debris. And then lymphocytes, those are what control the immune response and make antibodies to antigens. And this is a helpful video. I think this, or I'm sorry, visual, helpful visual to show you the blood. You have the 3 types of cells, and the leukocytes break down into those 5 that we just talked about on the last slide, and then your plasma, what all it has in it. And notice that the proteins are broken out from the water, salts, nutrients, hormones, and vitamins. And within those proteins, you have albumin, globulins, fibrinogen, and prothrombin. And then underneath the globulins, you have alpha, beta, gamma, and those, and gamma are your immunoglobulins, which are antibodies that fight off infections. So please make sure you study this slide, hint, hint, hint. Make sure you know it well as this slide, number 10. Please make sure you study it and that you know all of these types and what the differences are between them. All right, plasma. You need to know these plasma proteins, so study those as well. Blood types. You definitely need to know this slide. So again, another one to really study hard. Type A has A antigen and anti-B antibodies. Type B has B antigen and anti-A antibodies. Type AB has A and B antigens and no antibodies, which makes it a universal recipient, meaning the other blood types can give to this blood type. Type O has no A or B antigens and both anti-A and anti-B antibodies, meaning it can be a universal donor. So that's why type O, people with type O blood are wanted so often to give blood because they're a universal donor. It can be, that blood can then be used for anyone with type A, type B, type AB, or type O. And type AB, they want that person can receive any other type of blood, type A, type B, or type O, or type AB if it's available. Rh factor, there is an Rh factor in your blood. It's either positive or negative. So you have type A positive, type A negative, type B positive, type B negative, type AB positive, type AB negative, and type O positive, type O negative. All right, how does blood clotting work? You have coagulation, which is a fibrin clot, and you have anticoagulants such as heparin, warfarin, Coumadin, and there's some newer ones that have come out as well. So if you have an injured blood vessel, your platelets aggregate, meaning they get all together, and in combination with tissue and protein clotting factors, calcium, vitamin K, prothrombin, and thrombin, they change the fibrinogen to a fibrin clot and stop the bleeding. That is how that process works. So make sure, again, this is another slide you really need to know. Blood contains which of the following to transport oxygen? Where is oxygen transported? Not in white blood cells, not in platelets. So where else can it be? Blood contains which clotting cells? Which is a type of blood cell that has clotting factors in it, or not clotting factors, but it causes clotting. All right, vocabulary: albumin, antibody, antigen, basophil, bilirubin, coagulation, colony stimulating factor, differentiation, electrophoresis, eosinophil, erythroblast, erythrocyte, erythropoietin, fibrin and fibrinogen. Notice the difference between fibrin and fibrinogen, okay? Make sure you know that difference and which is which. Globulin, granulocyte, hematopoietic stem cell, hemoglobin, hemolysis, heparin. Make sure you know the difference between hemoglobin and hematocrit. And if you're not sure, look in the back of your book. In your there should be I'm sure there is in the back of your book. So if you're not sure the difference, it also should be in chapter 13. So know the difference between hemoglobin and hematocrit, those two tests. Immune reaction, immunoglobulin, leukocyte, lymphocyte, macrophage, megakaryocyte, monocyte, mononuclear, myeloblast, neutrophil, plasma, plasmapheresis, platelet, polymorphonuclear, prothrombin. Again, know the difference between thrombin and prothrombin. Make sure you know those. Reticulocyte, Rh factor, serum. And really quick, going back to Rh factor, we talked about Rh factor, I want to say back in chapter 2 maybe. So if you are wanting to know about that, please go back to chapter 2, I believe, and take a look at that. There should be information about Rh factor and how that works in pregnancy. Stem cell, thrombin, thrombocyte. And now we get to combining forms. And remember, it's our root plus our combining vowel to equal our combining form. We have baso, chromo. Notice the difference between chrono and chromo. Chrono is time, chromo is color. Coagulo, cyto, eosino, erythro. And look, we've got two that mean red, so watch out for that. Granulo, hemo, hemato. Oh, you've got two for blood there. Hemoglobino, iso, karyo. Leuco, mono, morpho, myelo, neutro, nucleo. Phago, poikilo. Cytero, sphero, thrombo. And now some suffixes. Apheresis, blast, cyte, cytosis, emia, gen, globin, globulin, lytic, oid, osis, penia, phage, philia, phoresis, poiesis, stasis. All right, let's talk about what can go wrong with blood. One of the most common things that goes wrong with blood is anemia. It's a deficiency in erythrocytes or hemoglobin. And here are some of the most common. These are not the only ones, but these are the most common. Aplastic anemia, hemolytic anemia, pernicious anemia, sickle cell anemia, and thalassemia. Your book goes over those, and so I would refer back to that if you have a question about the differences between those, but make sure you're familiar with them. And here they give us the definitions. And this is a nice visual to help you see the differences in the cell shapes between a normal blood cell, red blood cell, versus one that has an anemic condition. All right, most common type of anemia. If you're not sure about this, take a look back at your book, all right? Because I don't know that it talked about it. Did it talk about it here? It did not talk about it. So go back to your book and take a look. Hematochromatosis is an excess of iron deposits throughout the body. All that extra iron gets deposited somewhere. And then you have polycythemia vera, and that's a general increase in red blood cells. That's where the red blood cells are just multiplying much faster than they should. Things that can go wrong with blood clotting. There is a genetic hereditary disorder called hemophilia. In fact, this week's discussion there are two discussions. One is on chapter 13 and it involves hemophilia. So you'll get a chance to go in and read about that and do a little research on that. And then the other one, the other discussion topic is on vitamins, and we'll talk about vitamins a little bit with the lymphatic and immune system. All right, purpura is another disorder of blood clotting that can occur. What can go wrong with white blood cells? Well, leukemia is a very common disorder when it comes to white blood cells, and that is you have an increase in cancerous, notice the emphasis on cancerous white blood cells, and these are some of the most common types of leukemia that you may hear of. And this gives you a visual of the difference between the white blood cells, how they diagnose that between normal white blood cells and abnormal ones. On the left, you see acute myeloid leukemia. On the right, you see acute lymphoid leukemia. Other things that can go wrong with white blood cells include granulocytosis and mononucleosis. I'm sure you've heard of mono, the kissing disease. It was often originally said that it was passed by kissing or exchange of body fluids, like saliva. And that's where you get an infectious disease with large numbers of mononuclear leukocytes and enlarged cervical lymph nodes. Those are the ones around your neck. And so that's why when they're looking for mono, they're checking your lymph nodes around your neck to see if they are enlarged. Diseases of the bone marrow cells, well, there's something called multiple myeloma, and that's a malignant neoplasm, read cancer there, of the bone marrow. It's where those malignant cells destroy bone tissue and cause overproduction of immunoglobulins. So that's a very unfortunate condition. All right, what are some lab tests that are done on blood? You'll hear about all of these, I'm sure, if you go into the field dealing with blood in any way, shape, or form. Make sure you know the difference between a hematocrit and a hemoglobin. Make sure you know what a partial thromboplastin time, a PT is versus, I'm sorry, a PTT versus a PT, a prothrombin time. So make sure you know the difference between those. And then the rest are pretty much as they are. If you have more questions, I'd encourage you to Google those. Clinical procedures, there's apheresis, where they separate the blood into its component parts and then remove a select part. There is blood transfusion, where you have blood taken from a donor and infused into a patient, and you can actually do this yourself. They often do this with hip or knee replacement patients if they think a blood transfusion might be needed and the patient is healthy. They will have them come in a week or so or a week or two before the procedure and have them donate a unit of blood, and they will store it. And then if the patient does need a blood transfusion after the procedure, they can put the patient's own blood back into them. And that is a great, great option for many people. Bone marrow biopsy. This is where you go in and you take out bone marrow with a needle through the bone. It is extremely, excruciatingly painful. I've not had it, but I've talked to people who have, and they tell me that. Hematopoietic stem cell transplantation, where you're getting those either from a donor, usually from a donor, and then they're administered into a recipient. This is not something you usually do with yourself. This is something that has to be done from a compatible donor who has healthy stem cells. Abbreviations, and there are lots here. So study up, make sure you know as many of these as possible, as always. Okay, combining forms: baso, chromo, coagulo, cyto, eosino, erythro, granulo, hemo, hemato, hemoglobino, iso, karyo, leuco, mono, morpho, myelo, neutro, nucleo, phago, poiquilo, cytero, spiro, thrombo. And that is it for chapter 13, blood system. So I will be back shortly with a video on chapter 14, which is the lymphatic and immune systems, and that will finish up week 9. Hope you're doing well. Talk to you again soon. Take care.